This is episode 2 of 5 video presentations designed to raise critical consciousness of some of the possible economic, social and political factors that can influence our well-being. In episode 1, we discussed the Mental Health Foundation's finding that 74% of adults in the UK have been overwhelmed with stress at some point in the last year. Drawing upon Brothenbrenner's ecological model, it was suggested that there may be wider levels at which our well-being can be influenced. This takes an emphasis off of a purely individualistic focus, i.e. locating both the source and solution to well-being within the individual, and instead suggests that external factors could also play a role in our well-being. This specific episode will focus on the influence of economic issues such as poverty and inequality, and the potential effect that these can have on our well-being. Poverty is a difficult term to define, but the Joseph Rowntree Foundation provide a good description of what poverty means to those that experience it. Poverty is when your resources are well below your minimum needs, when you cannot afford to pay your rent or heat your home, and face the constant stress, insecurity, and marginalisation because of your financial situation. According to the Joseph Rowntree Foundation, 14.3 million people live like this in the UK. That's over 1 in 5 of the population that live in poverty. Now normally, we would associate poverty with people being out of work. However, worryingly, the rate of in-work poverty is on the rise, meaning that currently 4 million people in paid employment in the UK are struggling to afford to meet their minimum needs. Poverty is therefore a large issue in the UK, and there's evidence to suggest that it's associated with mental health and well-being problems. For example, the Marmot Review is a document proposing the strategies to reduce the social determinants of health inequalities. Factors like income, housing, education, healthcare and the local community, all of which have an impact upon our health and well-being. In this review, it was reported that those in the bottom 20% bracket, according to income earned, were 2 times more likely than those in the highest 20% bracket to develop common mental health problems, such as depression and anxiety. Of course, it's difficult to determine all of the factors that could underlie this relationship, but the figures suggest that poverty has an adverse effect on mental health and well-being. One possible factor that could help explain this relationship is debt. Debt is more prevalent among low-income households and has been reported to have a negative effect on one's well-being. For instance, in a systematic review of 65 studies, it was reported that debt was significantly related to an array of mental health and well-being issues, such as common mental disorders, depression, anxiety, suicidal thoughts and attempts, as well as drink and drug use. Additionally, remembering the Mental Health Foundation study, finding that 74% of adults in the UK have been overwhelmed with stress at some point in the last year, money worries were cited as a major source of this stress, particularly regarding income, paying bills, and struggling to afford to meet their basic needs. It would seem then that economic factors relating to poverty and debt can have a negative influence on our mental health and well-being. Furthermore, the economic inequality present in the UK could be described as another factor affecting people's well-being. Economic inequality can be spoken about in different ways, but generally refers to the uneven distribution of income or wealth in our society. Here, we will focus specifically on income inequality. As compared to other developed countries, the UK has very high levels of income inequality. Although the two are related, economic inequality differs from poverty, as poverty refers only to those poorest and most deprived in society, whereas economic inequality refers to the gap between those that have more and those that have less among a whole economic distribution, i.e. across low, middle and top income households. Therefore, this imbalance does not just affect those that are poorest in society, it can be seen at wider levels within the population. Yet, as expected, the most notable gap is between the rich and the poor. For instance, the poorest 20% have an average original income, the sum relating to earnings, investments and pensions, before taxes or cash benefits, of £7,400 per year. This is 12 times less than the richest 20% that have an average original income of £88,800 per year. If you break these figures down into a pie chart, including the other fifths of the population to represent the total income of the UK, you can see that the poorest 20% share just 8% of the total income, which is less than the second poorest fifth, who share 13%, the third have 17%, the fourth 23%, and the richest 20% own 40% of the total income of the UK, a larger proportion than the bottom 3/5 combined. And of course, this is only comparing the top 20%. When concerning the top 10, 5, or even 1%, the economic inequality in the UK becomes even more apparent. There is evidence to suggest that this level of income inequality present in the UK is potentially problematic for our mental health and well-being. For example, in a recent systematic review of 26 studies, Patel et al. Reported that almost 2/3, an N of 16, found a significantly positive relationship between income inequality and a risk of depression, with populations that have a higher level of income inequality demonstrating a greater risk of depression relative to those with lower income inequality. This finding was present at both a regional, within country level, for example at a village, county or state scale, as well as between countries at a more global scale. As the greater risk of depression was more apparent among lower income participants, it was suggested that factors such as social comparisons or status anxiety could help explain this relationship. It would seem then that income inequality can be harmful to our well-being, as it creates a hierarchy through which people judge themselves. This has the potential to lead to lower self-esteem, stress, and depression due to status anxiety. Worryingly, these findings suggest that worsening mental health statistics are to be expected in the coming years as levels of income inequality continue to increase both globally as well as nationally. Reducing such income inequality could be key to seeing an improvement in health and well-being in the UK. Furthermore, the economic inequality present in the UK can be described as additionally problematic, as it can manifest itself as structural inequality. Structural inequality refers to a system of privilege, whereby those at the bottom of the economic ladder are attributed unequal status and opportunities in society. Examples can include a multitude of factors, such as the quality of education for children at local schools, job opportunities, housing availability and affordability, transport links, and access to healthy, nutritional food, all of which can affect our health and well-being. A recent news story by the BBC Inside Out West highlighted the potential effects of both economic and structural inequality, using the city of Bristol as an example. Easton and Clifton are two Bristol wards that are less than 3 miles apart in distance, but figures suggest that Easton is one of the poorest and most deprived areas of Bristol, whereas Clifton is one of the most affluent. There is a clear difference in life expectancy between the two wards. Figures from the Bristol City Council show that residents living in Clifton are expected to live on average almost 10 years longer, to 88.1 years, than those in Easton, 79.6 years. These figures demonstrate the disparity between the two Bristol wards that are close in proximity but distant in terms of wealth and resources, which suggests the negative impact that wider economic, social and environmental conditions can have on our health. Now, why is there a difference? There are potentially lots of reasons, and it's likely that a number of the structural inequalities described earlier could be present here. But it does question what varies between these two areas to warrant such a large gap in life expectancy. One issue that was identified by the previously mentioned news story was access to food. In Easton, there are around 44 takeaways that serve quick, cheap, fast food meals for as little as £2.50. They are easily accessible and affordable for the low-income families that live in the area and are eaten regularly by the young people in the community. There are concerns that this readily available junk food is having a direct effect on the health of the local population. By comparison, in the more affluent area of Clifton, there are only 7 takeaways, 6 times less than the amount in Easton, serving a similar sized population. And the meals here are not your average kebabs and burgers, but fresh fish and chips that will set you back around £8.50, a price that is equivalent to more than 3 fast food meals in Easton. Now, this is not to say that the takeaway meals are the single explanation for the disparity seen between the two Bristol wards, as it is much more complicated than that. But if you have less money, less time, lesser transport links, and less access to healthy, affordable, nutritional food, then you might be more likely to eat cheap, quick, unhealthy takeaway meals, suggesting that structural factors resulting from economic inequality could have an impact upon our health and well-being. Overall, the evidence has suggested that economic factors relating to poverty and inequality can have a large influence over our health and well-being in the UK. The next episode will highlight the potential ways in which political factors, specifically capitalism and neoliberalism, could also be influencing our well-being.